My name is Alex McLawhorn. I am a joint replacement surgeon at the Hospital for Special Surgery. So I commonly see adult patients who have degenerative conditions of their hip and knee, most commonly degenerative conditions of the hip like osteoarthritis, avascular necrosis, childhood diseases that will go on to require joint replacement surgery. In terms of my approach to patient care, I really have an individualized approach for every patient. We try to understand where they're coming from, what their expectations for treatment are, what their expectations for recovery are, and we try to match the best treatment, whether that's non-surgical or surgical treatment, to their problem, to their expectations, and helping them achieve the goals that they're trying to achieve. Robotic joint replacement surgery allows us to precisely perform the joint replacement so we can achieve a reproducible outcome. It allows us to customize the position of the components. That being said, the robot is really a tool that we use during the operation, and most of the surgery is still performed with me using my own hands and using traditional techniques. So my primary goal as a joint replacement surgeon is to reduce pain and restore function via a painful hip or knee. That's really a process, and I view it as my job to shepherd the patient through that whole process, from our first consultation to the decision for surgery to the recovery, and then ultimately getting patients back to where they want to be in terms of activities, whether that's playing with their grandkids or playing a high-level sport. Patient education is a really important part of my practice, and a large percentage of the time that I'm going to spend with patients is going to be educating them on their treatment options, on what they can expect in terms of surgery, recovery from surgery, and so a lot of that patient education is really about aligning our expectations for care. I think the most important thing for a joint replacement patient is to choose a surgeon whom they believe is going to choose the right surgery for them at the right time and be able to provide that surgery in a facility that's focused on delivering the best care for orthopedic patients. So the best part of my day as a joint replacement surgeon is having a patient come in and tell me that we've exceeded their expectations in terms of not only outcome, but also the care they've received from me, from my staff, and from the hospital.